Hello and welcome to Riverside OBGYN residency program. We're so glad that you are looking at our video and able to join us for more information about our wonderful OBGYN residency program. I am Barbara Simpson. I am the program director here at Riverside, and I've been with the program for a little over 5 years, including faculty time, and I've been the program director for a little over 4 years. So very excited to be embarking on this next interview season. I wish things were different. I was so hoping that this would be in person for this year, but certainly due to COVID, it's changed everything and kind of set everything on its ear. So here we are doing things in a virtual format and added onto that, having things recorded. But at least this makes it so as you guys go through the interview processes at different institutions, you have a way to look back at our program and remind yourselves about the things that we offer here. And hopefully it can answer questions and reminders of what a great place we are to train. My hope was to certainly do this in person. So this is interactive, so we can talk more about our program and our hospital and the wonderful community where we are, because we are very much a part of the community. But this little process will at least give you some more glimpses of the residents, of our faculty, and of the many things that we offer for the next 4 years of your life as you grow and train to be OBGYNs, and whether you then go on to private practice in our community, or else maybe you go back to the community where you are living right now, or you decide to pursue a fellowship. We do have those pathways as well. But whichever, we want to develop you into the best possible OBGYNs that you can be. And during the time, you'll learn a lot more about, of course, the specialty, but about yourselves as you grow. And then hopefully have some enjoyment of the 4 years here with us too. So I will share PowerPoint and kind of take you guys through those slides. And hopefully it's not too terrible. Again, it's hard doing this when it's not interactive. So I'm going to go ahead and see about sharing my screen and take you through a little bit more about our OBGYN program. So one of the people that you will have been in contact with through this process is Betty Hamrick. So she's our wonderful program manager. And then her together with Rochelle are the ones that really help keep things running. So such a big part of making our program successful, helping our faculty to stay together and get things done, our residents to get things done, keep up with all the ACGME requirements and all the fun paperwork. So here's our hospital. We actually have a beautiful large facility. And one thing about it is, I think with most hospitals, it's always growing, changing, improving. So just in the 5 years that I've been here, we've had a new labor and delivery unit. We've actually added on to the hospital. We actually now are up to about 450 bed capacity, and that's all private rooms. So we are a large hospital system. We're in Newport News, Virginia, so Southeast Virginia. It is a wonderful place to be, especially if you like the water. And we have actually a very scenic setting. We have a lot of trees and green space around, so it's actually a really nice setting to work. So I'm showing some views of the front of the hospital, kind of the side view that incorporates the pavilion addition, expansion, and helicopter coming in to land in the front. COVID-19 is something that we'd hoped we would leave behind with 2020. Unfortunately, it's still with us, but we still make everything work. We've had to, of course, modify and grow and adapt. It certainly has influenced your training. It's influenced our residents' training here. Although mine have still met all of their surgical numbers, their delivery numbers. Labor and delivery tends to be, still a very busy place. The OR has been waxing and waning, unfortunately, because of our COVID numbers had increased in this area to the point that we really had very limited hospital beds. So that did decrease our surgical volume from the end of August until the beginning of October. Now we've seen those numbers go down drastically, we're back to normal operations. So now we're playing catch up to get our patients their needed surgery. So anybody that couldn't wait, of course, still had their surgery, but anybody that could, we did postpone. So now we're in that mode of getting everybody back on the OR schedule and getting our residents back and doing their thing. And that's where they are. Our GYN group is busy today in the OR. So this is just a quick map overview of our area. So we are located in Newport News, and you can see all the surrounding water. Hampton Roads is several communities that are all kind of geographically close, but some of us are separated by water. So we do have tunnels and bridges and things, but unless you choose to live across the water, which I do. So I do take a bridge every morning to come into the hospital, but I enjoy where I live. Otherwise, there's so many great places to live that are within 5 minutes of the hospital. A lot of the residents live that close. Some live as far as Williamsburg. So lots of great areas that they'll be able to talk with you more about as you continue your interview day with us. Riverside Health System is actually a system that's been around for over 100 years. So the first hospital started serving the community in 1916. Riverside Health System actually has 4 acute care hospitals, and Riverside Regional, which is where the program is based, is the largest, and that's the one in Newport News. The residents do go to 2 of the other hospitals if they choose to. So we have a Riverside Doctors in Williamsburg, and we have Walter Reed in Gloucester, and some of the private group go up there to do surgeries, and the residents are always welcome to go up and do those cases with them. We do have a behavioral health hospital, and then 2 other specialty hospitals, a rehab and critical illness kind of recovery hospital, 6 nursing homes, retirement communities. And I mention that just because Riverside is actually a very stable health system. So it's not just a standalone hospital. So they're financially sound. They're really entrenched in the community, really committed to being partners with the community with improving health. The OBGYN program has been at Riverside a long time, really since the start of ACGME, which is say in 1971. We actually had residents even before that, but that's really the first kind of official documents in conjunction with the ACGME are from that time frame. And we've gradually grown from initially 1 resident to 3 residents per year, which is where we're at. There are 5 residency programs here at Riverside. So family medicine, which is actually the largest family medicine program I believe on the East Coast. The new emergency medicine residency program. So that's has 2 years in now, and we have a transitional year residency and a pharmacy residency. So Riverside is very committed to education. So both with graduate medical education, they've long had their own nursing school, and now really other health professional schools too. So every part of the hospital is geared for learners and used to helping everybody to learn and grow. The hospital complex here at Riverside Regional has several main buildings on it. So I'm currently sitting in the annex building, which is where medical education is, and we have a conference room there as well as offices. The Tower Hospital is the older part of the hospital, which is where labor and delivery is. The Pavilion Hospital is just an adjacent building. It's all attached. And that's where the ER, the ORs are all over in that part of the hospital. We have a cancer center on the complex, medical offices building, and then picture right here is our Peninsula Surgery Center. It's our outpatient surgery. So we can walk there. It's behind the hospital, so just across 2 parking lots. It's always a good way to get your steps in and get a little outside time. And then we have our Brentwood Clinic, which is where the residents see all of their patients. And that is a 5-minute drive from the hospital. So this map just shows a little bit more of just the hospital complex. It's a big complex. So the main hospital, you can see there in the center, the surgery center sits kind of in the back, the cancer center. So like with gyn-onc, you'll spend time over in the cancer center. That's where the GYN oncology clinic is. Medical office building also houses the private group that's here, and you guys will spend some time in their offices as well. So kind of all areas. And the Peninsula Health Department actually sits right in the front alongside the hospital. So a good resource for our patients, all very close by. The pavilion was the newest, was a kind of the biggest addition onto the hospital. So that was opened in 2013. And with that, they redid all of the ORs. So at that point, just 12 operating suites, pre-op and PACU, and then also med-surg unit, all were built at that time. And then they just recently finished adding on to the pavilion. So now there's 5 floors. They added all new spaces for the ICU, so the medical ICU, the SICU there is there, the cardiac care unit. So they kind of transitioned all of the ICU space into this new section because of the state of the art of the patient rooms. And the other nice space, and I didn't put a picture up, but there is a sanctuary, so kind of a quiet space that we've used for meditation, for reflection, for wellness. And it's something that the chaplains go to and is available at any time that anybody needs it. NICU. So we actually are the only NICU on the peninsula. So this area for Hampton Roads, we are the only NICU, and we do go down to 23 weeks gestational age. And really we're pushing the cusp of, even late 22 weekers are possible depending on size and things for resuscitation with our NICU. So we work very closely with them with communicating what patients we have concerns about, preemies, things like that. It's 24-hour coverage, so there's always NICU in-house, and they come to, of course, all of our C-section deliveries, and then anytime we call them, they'll be there for any of our vaginal deliveries. And I worked on Labor Day, and that's a picture of one of our babies that got a Labor Day onesie, certainly putting the meeting in Labor Day. So emergency department, so that was redone as well in 2013. It's a level 2 trauma center. So the only thing that we do not have either transplant or a burn center. Those are the things that would make it a level 1 trauma center. So something that Riverside decided to not go into. And there are 2 level 1 trauma centers, Norfolk and then Richmond would be those. Otherwise, we are the only one trauma center on the peninsula with 42 patient rooms, so a large ER. They stay very, very busy. And we get to know them quite well with going down there for consults, imminent deliveries, things like that. They also have an observation unit, so sometimes we'll utilize that when we want to watch somebody, say they need a transfusion or other observation without being fully admitted to the hospital. That's a picture of trauma 1. Trauma 2 looks very similar, but trauma 2 is the one that typically any OB patients are placed into for us to come down and evaluate in an emergent manner. Labor and delivery. So this unit was totally redone in 2016. So actually right as I joined Riverside, just a few days prior to me starting shifts with the residents, they actually had the ribbon cutting. So I got to experience right away this brand new unit, which has been amazing. Large labor rooms. We have 4 antepartum rooms, which sit right behind the nurses' station, so all very close by for any of our patients that need to transition back to a labor room. We have 3 triage rooms, and then we have our own 2 ORs right there on the floor. Again, all new in 2016. And then we do have nice things like therapy dogs that do come up to labor and delivery to see any of our laboring patients or our antepartum patients who need a little pick me up from Kirby. So we like Kirby too. The OR, so that was redone in 2013, and actually since has grown. Now there's 16 operating rooms from the 12. We do have a Da Vinci robot. The hospital had recently upgraded to the newest, which is the XI. So several of our faculty do use the XI. So Dr. Irvin, who is our GYN oncologist, and then Dr. Fish, who is one of our full-time faculty, who's also MIGS, will do cases on the robot. A couple of the private physicians will as well, but those are our main users for OBGYN. And otherwise, just kind of a normal OR for us with full capabilities. Clinical volume. So we stay busy here at Riverside. So visits at our clinic, about 13,000, more than 900 surgeries per year, and that actually is growing. Deliveries last year was 2682, and then outpatients, we almost double that at 4985. So again, a busy place, so lots of learning and patient care going on. I mentioned about our Brentwood clinic. So that's about 5 minutes from the hospital. So very easy drive, 2 turns. With that, we actually share the building with family medicine, which is great because it helps our patients to really have kind of the holistic care that they need. So our OB patients, if they have comorbidities like chronic hypertension or diabetes, or even if they have preeclampsia during pregnancy, which shows us that they have those tendencies, we can make sure that they have access then to primary care outside of pregnancy. Our clinic has 12 exam rooms. We have 2 ultrasounds. One stays mainly in a room, so we have kind of an ultrasound room. The other we utilize in any of the rooms as needed, but they're both of great quality, great visualization. We have a procedure room, so that room's set up for us to do things like colposcopy, leaps, hysteroscopy. We actually have our own lab person that's right in our clinic to make that as easy on our patients as possible. So we do all our blood draws right there. We don't have to send the patients to any other location. We do our own immunizations, of course, ROGAM, and then we have NST machine, which we're looking to expand. Just seems to be more and more of our patients are high risk and need routine NST. So that's an area that we're looking to expand to make sure that we're providing all that care versus referring patients to our own high risk clinic, which we do jointly with MFM. So this is our faculty. I want to say the newest faculty member really is probably Dr. Fish, who's been here 3.5, almost 4 years now. So everybody's been with us for a while with recruitment. It's just been such a great place to work. We just really don't see a lot of turnover, which is wonderful. Dr. McMullen's been with us the longest. He has been here with us more than 12 years. Dr. Khan was a graduate from this program, as was Dr. McMullen. And Dr. Khan was then with the private group and then came over to faculty. Dr. Hasling just hit 8 years being with us. She actually was in the Army before her time with us and is still in the reserves as a colonel. Dr. Fish is MIGS. So she's heading up a lot of our laparoscopic training, as well as then robotic pathway for those that want to get their certificate before they graduate. Get those cases. And then Dr. Jones-Ives has joined us as well. And then I kind of round things out. And we're actually currently recruiting for another full-time faculty just to keep plenty of folks for you guys to work and train with. Dr. Bill Irvin is our GYN oncologist, so he's full-time here at Riverside, and the residents love working and learning from him. So we always keep 2 residents on rotation with him, first or second year, and then a third or fourth year. And he stays extremely busy. We also have part-time faculty. So EVMS, which is close by in Norfolk, we utilize their maternal fetal medicine specialists. So the specialists come over, they have consulting privileges. So they come into the hospital, they'll do consults on our antepartum patients. They don't do procedures, so there's no procedures that we lose. We still do everything here ourselves. So the names you see there are ones that will do didactics for us. So they do a weekly lecture. And then depending on who's on that day, they'll do our consultations. And then they also rotate through running our high risk OB clinic, which we do every Tuesday. They have a local office. Again, that's 5 minutes from the hospital. And on Tuesdays, the residents go over and do a high risk OB clinic with them. So they really work hand in hand with us with managing these high risk OB patients. Our residents also go and do ultrasound rotations with them, and then can opt to do further MFM rotations as well. We also have part-time faculty in the form of Partners in Women's Health. So that's the private group here at Riverside. So we've got a number of folks, as you can see, that work there. The residents work with all of them. So we do all of the GYN surgery with them. So the residents go in with all the cases. The only cases they miss is just sometimes there's too many for the residents to all staff. Also the C-sections, the residents do all the C-sections with the partners group as well. So a lot of great experience learning from all different people. So really have a number of approaches to the same surgical question. So when you leave here at Riverside, you'll have a number of ways that you've learned how to handle various, problems and issues that you'll find in the OR to take good care of your patients. We also have an additional community GYN oncologist that the residents work with, Dr. McCann. He has privileges here at Riverside, although his primary site, he's with a different hospital system. So he'll cross cover sometimes with Dr. Irvin, and otherwise he is at the other local Newport News hospital, which we're actually in the process of getting the residents into being able to rotate and operate there as well to increase our even more numbers and things for them. He loves to teach, so it has really been a great asset for our residents for increasing their learning even more. Other administrative folks. So as I mentioned, Betty Hamrick is our program manager. She's had many years of experience with ACGME, so she is a wonderful guide and almost like a mom to the residents. So Rochelle has been a great addition to our program as our wonderful administrative assistant. With helping the residents with their needs. And then Kirsten is the administrator over Med Ed in Brentwood. And then Susan does our coding and our billing. So she helps with the residents with learning that aspect of things, because certainly all the coding gets overseen here, but we want to make sure that you're prepared for when you go out in the world and have to learn how to do it for yourself. Our graduates, our program really has a community focus. So our goal really is to make excellent generalists that go out and know how to do the latest things, what ACOG recommends as far as high risk OB care, because really, I think almost any community you're going to go to now, you're going to have high risk patients. That's just the nature of our communities, the nature of our country, is that we see a lot of patients now that are pregnant that have diabetes, high blood pressure. So you'll be well versed and able to take care of those patients within your own practice. You won't have to utilize MFM for every patient that's walking in your door, because you'll have done it, you'll have managed it here. We're doing so many things now laparoscopically, robotic options. So really make it so you're well-rounded and ready to, stay here in our community or go back to your own community. And we do have residents that have chosen to pursue fellowships. So several have gone on to MIGS fellowships, and I have had one resident 3 years ago decided to pursue MFM. So she has just finished up her MFM fellowship. So things are possible, because you might start as a generalist and decide there's one area that you really do love. So we can make those things happen. But overall, and most of what we do, we really gear you up to be ready to go back and provide excellent care to your community, increase that access to care that's so desperately needed. Last year's graduates, so Suzanne, she's in Maryland now in practice. That's where her family was. Alex joined her family down in Florida. And then Jared, we stole from Kentucky, and we've gotten him to stay here. So he's still actually here at Riverside and joined our private groups. And now it's nice my residents actually get to work with him as a private attending. Our fourth years that hopefully you will meet during kind of some of the socials and during our interview day. So we have Amy, Lilium, and Tania. Our third year, so we have Jack, Lauren, and Jeremy. And again, faces hopefully that you all have seen through some of our videos and things, and then also meet during our socials and our interview day. Our second years, we have Grace and Brittany and Jordan. And then our wonderful interns, so we have Brittany, Karen, and Jerry. And I can't believe we're already at the point that we're looking for the 2022 interns. So rotations. So you guys do a number of rotations, of course, during your time here in residency. So OB, GYN, Gyn-onc, we do an ambulatory GYN and SICU combination month, so 2 weeks in the SICU and then 2 weeks that you're doing clinics, including with the private group. We have ultrasound rotation. You'll do a NICU rotation, REI, and then we have a variety of electives. You do get elective time. So 1 block in your second year and 2 blocks in your third year to do electives. So pursuing what you're interested in. We do have Urogyn that's kind of incorporated a little bit throughout, but then you can also pursue separate Urogyn elective rotation, family planning, further MFM, community GYN oncology, with Dr. McCann, research, ultrasound. So we have all of these things. And if there's a particular interest that you have, we have the flexibility to try and make those things happen for you. Scholarly activity. So everybody is going to be required through the ACGME to do a project before you graduate from residency. So that's something that every program is going to require. Our kind of most recent submissions, APCO-CREOG, Dr. Mitchell had sent hers in for FLS curriculum. Dr. Neely had submitted his to ACOG last year for optimizing postpartum care. And then this year with our ACOG district, Dr. Klinger presented her identifying causes and neonatal outcomes for delayed cesarean. So we're just kind of trying to troubleshoot. So we do a lot of quality improvement here. We're not as geared as a community center for hardcore research, although I did have one of my residents a couple of years back who went into MIGS, did manage to set up a randomized controlled trial on wound closure. And actually, one of my other residents is starting on a project right now that's going to be a continuation, also is going to be a randomized controlled trial. So it can be done. It's a lot of effort. But it can be done. Otherwise, we're looking to improve patient care constantly. So there's a lot of ongoing projects right now that we're excited to be a part of, again, improving the care here in our community. So this is presenting at our corporate research day. Of course, we didn't have that because of COVID. So this is from 2 years ago. We have a sim lab. So the sim lab opened up a little over a year ago. It's named in honor of Brandon Rogers, who was a family medicine intern who was killed at the end of his intern year in a car crash. So in his memory, we've created this sim lab. State-of-the-art, wonderful space. Our OB room is actually modeled after Labor Room 3, and we have Real Mom, who is a very realistic birthing simulator. You're able to do operative vaginal deliveries on her, normal deliveries, breech, shoulder dystocia, hemorrhage. Again, very, very realistic. So we're utilizing that once to twice a month. We're down there for kind of bigger simulations as part of our protected didactic time. And then in between, we go down for smaller drills and experiences, just depending on when we've got folks. We also have our own laparoscopic trainers for FLS, and we have those available 24/7. So when residents have downtime, a lot of times you'll find them coming up here to make use of their time. Our newest addition to our sim lab arsenal is the MIA model. So great for us working more on vaginal hysterectomies and sling training. We do have a virtual reality classroom. We have ER and ICU simulation. So it's a really great addition to our health system to have this center. So we've done our also course, so our OB emergencies. We've done that course already. Here we're taking our interns through it, and now we're starting to take some of our providers through that. So it's been a really great addition for us. Some pictures of us doing some drills. We have C-section trainer, and that's one of the bodies that you see up there. And then our Real Mom with giving birth, and the room is big enough. We've actually done kind of multiple stations at the same time to keep everybody learning and hands-on. So a really great space. We do other labs too. So just in our conference room, we did recently a beef tongue lab to work on 4th degree repairs. It was actually very realistic. I was very impressed. So suturing practice, again, with the beef tongue. We've done further FLS trainers and morselization. So we're always looking to incorporate some hands-on didactics. So our didactics, which are every Thursday morning, so it's protected time from 7:30 to 12. So we will do lectures during that time frame, talks, MFM lecture, and then at least once a month we do a big block of simulation as well. And then wellness is important. So during your time here with us, we do prize that interaction and that teamwork and just the way my residents support each other and celebrate things together. It's a great aspect of our program. They're such a close-knit group, and they're a diverse group. They have really bonded well though from wherever they've come from, be it Virginia, be it somebody from Texas. It's we kind of have a wide range of geography in our little Virginia program, and everybody is really bonded well and so supportive of birthdays, of accomplishments, and helping each other through tough times, and said promoting wellness. So we actually won the Resident ACOG Wellness Award for 2020 with the resident videos. We celebrate birthdays and anniversaries. This was one of the wellness retreats. We did that at Go Ape, which was a high ropes course, which was a lot of fun. The residents have otherwise chosen to do axe throwing, laser tag, let's see, top golf and escape rooms. So we do try to let them have ways to bond and get to know each other outside of being here at the hospital. We went to a baseball game. This was pre-COVID, and got to do that. It's just a fun event because there's so many things going on here in the area. So leads me into it's a great community to be a part of. I've been in this area, I guess, 11 years now, since residency, and just love living here in Hampton Roads. There's always things going on. We have the Mariners Museum that has events, the Ferguson Center for the Arts, City Center, which has like kind of outdoor shopping, restaurants. They have a lot of cultural things going on. They've got live music. They do a farmer's market once a week. They celebrate the holidays with fireworks. And then we're so close by to other great historic areas: Smithfield, Yorktown, Williamsburg, Jamestown. We're close to the beach. And then there's sports teams as well. So many things going on at any given time in the community. This is my residence prior to our graduation ceremony. So we were out having lunch together, enjoying a little sun time. Halloween in the clinic, so everybody gets in the spirit and has fun while they're working. This is our resident lounge. We had to do sign out in there instead of our typical one in the mother infant classroom, so nobody minded, I think, getting close together. Some of our graduates posing for a photo together before they left. And I'm just going to leave you with this last thing. Our mission statement. So it's very much a part of who we are here at Riverside and how we want our residents to learn and grow and go forth to take care of their patients. That our mission statement is to care for others as we would care for those we love, to enhance their well-being and their health. So we're really a partner in our community's health and their wellness. And just as faculty, we're a partner in our residents' health and wellness, their knowledge, their growth. Everybody here is with that same goal, that same focus, and that's to, of course, take care of our patients. But our goal is also, we want our residents to learn and grow in the best environment that we can give them. And I think we've certainly accomplished that here at Riverside. And we're always growing. We're always looking to embrace what we need to do to adapt, whether it's COVID or new recommendations from ACOG. We're always growing and changing and adapting to what our community needs, and we're growing and adapting and changing to adapt to what our residents need. And we hope that you will consider becoming part of that for 2022. So thank you for watching this, and hopefully you'll be joining us soon for our interview day. Take care. Stop the share.